Hey folks, it's Dr. Mike. I'm back here again for another tip in our Medical Exercise Training 101 ebook series, and this is tip number 44. Now, you can go over to met101ebook.com and download your copy of our ebook. You'll get a digital copy. It's a great book. It's 101 tips that we've given to medical exercise professionals over the last 31 years, helping them build a medical exercise training practice that gets referrals, produces outcomes for the clients, and is most importantly, profitable. So tip number 44. This is one, you can read it in the book. It's rather long, but I'm just going to summarize it for you. The idea of medical memberships. Now, folks, when we first started thinking about the idea of medical exercise training or even post-rehab fitness, we encountered a young man who had come to us after an ACL reconstruction. I knew the surgeon well. The young man went to school in Minnesota, particularly Minneapolis, Minnesota. I was in Washington, D.C. Well, after we worked with this young man, it was over the spring and then the summer break. We got him to the point he was ready to go back to school, but he wanted to work with a gym in his community. He wanted to get a membership in this gym, and they had a post-rehab program. Well, it was a great idea. The gym set it up, and they offered either 3, 6, or 9-month memberships that were a little bit flexible, which is great. Well, the idea of medical membership should be a component of every client's exercise program if they have a significant injury or condition. If they are hypertensive or diabetic, they need ongoing exercise. If they've had a hip replacement, after physical therapy, they need ongoing exercise. ACL tears, back surgeries, after physical therapy is done, they need an ongoing exercise program. Make these programs simple for the client to get into. I have referred patients to health clubs, and the health club managers or the sales process is so tedious and so difficult, there's no leeway for the client. And many of these individuals don't need year-long memberships. They just need 3, 6, or 9 months. And with that, make sure you give them some level of education. Now, I understand the client buys a membership, but with this medical membership, let's make sure we give them a little bit more with the medical membership, in that they should at least get a screening. And on a monthly basis, they should be reassessed and their exercise program adjusted, and then that report is sent on to their doctor. Another thought is the idea of providing education to these clients, especially if they do have hypertension or diabetes, or they've had a total joint replacement, or even a back injury. You might want to look at the idea of offering some lifestyle management in conjunction with exercise. So this becomes lifestyle management plus exercise. That's a great formula for making sure the client doesn't re-injure themselves. And the medical community loves it, and we found insurance carriers love it. So here at the Medical Exercise Training Institute, we have our MedFit group training programs. There'll be a link down below. We have group training programs that offer the idea of a 10-minute educational component. We provide you with the slides and the presentation, along with an exercise program for another, say, 30 minutes or so. This now gives you both education plus exercise. That gives us a positive functional outcome. Look down below, you'll find a link, and with that link, you can go over and check out our MedFit group training programs. And we have training programs for arthritis and total joint replacements, hypertension, diabetes, and obesity, women's fitness, and then also we have a program for lumbar conditions. With these programs, it gives you the educational component in the form of slides we've already made for you. We'll personalize the programs with your name or your company name on them, and we also have handouts for you. Folks, please don't think that the doctor, therapist, or chiropractor didn't give the client or the patient all the information they needed. They did. But that individual forgot when they left the office. And they show up at your doorstep and they say, well, the doctor never told me that. The therapist never told me that. We did. So what we need is someone that now becomes our eyes and ears and our voice out there in the community to say, hey, here's how you should manage your lifestyle now after you've had that surgery or that injury, or now you have that condition. And we've even found some insurance carriers will actually reimburse for that. So thank you for watching. Please make sure that you go over to met101ebook.com, download a free copy of this, and check out our MedFit group training programs. I think you may find they may be helpful for you, even if you're a one-on-one trainer or you're a trainer in a club setting. They work in both instances. All the best. Take care.